Dear students, today we will discuss on diseases of tomato and its management. Tomato is an important vegetable crop grown throughout the world. Ripening fruits are good source of ascorbic acid, organic acid and minerals. The prevalence of high humidity and warm temperature during crop season makes the crop vulnerable to the attack of various fungal and bacterial pathogens, causing significant yield losses. The present topic will give knowledge regarding symptomatology and management practices of tomato diseases. First of all, let's discuss on fungal diseases of tomato. First disease is the damping off. It is caused by Pythium aphanidermatum. Symptoms of the disease. Damping off of tomato occurs in two stages, that is the pre-emergence and the post-emergence phase. In the pre-emergence phase, the seedlings are killed just before they reach the soil surface. The young radicle and the plumule are killed and there is complete rotting of the seedlings. The post-emergence phase is characterized by the infection of the young juvenile tissues of the collar at the ground level. The infected tissues become soft and water-soaked. The seedlings topple over or collapse. Next is the management of the disease. Use raised seedbed. Pots or transplant containers should be disinfected with 10% household bleach or fungicide drenching of Ridomil Gold MZ plus Babistin at the rate 2 gram Ridomil with 1 gram Babistin per liter of water. Drench with copper oxychloride at the rate 0.2% or Bordeaux mixture 1%. Seed treatment with Trichoderma viridi 4 gram per kg of seed or Thiram 3 gram per kg of seed is the only preventive measure to control the pre-emergence damping off. Spray 0.2% metalaxyl when there is cloudy weather. Next important disease is the Septoria leaf spot. It is caused by Septoria lycopersicea. Coming to the symptoms of the disease. Symptoms usually first appear on the older lower leaves and stems when plants are setting fruit. Symptoms commonly develop on leaves but can occur on petioles, stems and the calyx. The initial symptoms are small water-soaked circular spots of 1/16 to 1/8 inch in diameter on older leaves. The center of these spots gradually turn grey to tan and have dark brown margins. The spots are distinctively circular and are often quite numerous. As the spots age, they sometimes enlarge and often coalesce. Next is the epidemiology of the disease. The fungus require high moisture for infection and disease development, but can cause disease at a wide range of temperature from 10 to 27 degree centigrade. Now coming to the management of the disease. Removal and destruction of the affected plant parts. Seed treatment with Thiram or Dithen M45 at the rate 2 gram per kg seed is useful in checking seed-borne infection. In the field, spraying with Mancozeb 0.2% effectively control the disease. It is also helpful to practice a 3 to 4 years rotation with non-solanaceous crops. Staking and mulching can also help reduce infections. Next disease is the Fusarium wilt. It is caused by Fusarium oxysporum forma species Lycopersicea. Now coming to the symptoms of the disease. The first symptoms of the disease is clearing of the veinlets and chlorosis of the leaves. The younger leaves may die in succession and the entire may wilt and die in a course of a few days. Soon the petiole and the leaves droop and wilt. In young plants, symptoms consist of clearing of veinlet and drooping of petioles. In field, yellowing of the lower leaves first and affected leaflets wilt and die. The symptoms continue in subsequent leaves. At later stage, browning of vascular system occurs. Plants become stunted and die. Now coming to the epidemiology of the disease. Low soil moisture and temperatures around 28 degrees centigrade are favorable for the disease occurrence. It is more damaging in warm climates and is more serious in sandy loam soils. Now coming to the management of the disease. The affected plants should be removed and destroyed. Spot drains with carbendazim at the rate 0.1%. Crop rotation with a non-host crop such as cereals. One of the best ways to control this disease is to plant resistant varieties. Apply lime to the soil to bring the pH up to the neutral ranges of about 6.5 to 7. Since root knot nematodes can lessen resistance to Fusarium wilt, do not let nematode population build up in soil. Avoid injuring plants' roots by not using a hoe or cultivator around tomato plants. Damaged roots are entry points for the pathogen. Next disease is the Verticillium wilt of tomato. It is caused by Verticillium alboatrum and Verticillium dahli. Symptoms of the disease: the bottom leaves become pale, then tips and edges die, and leaves finally die and drop off. V-shaped lesions at leaf tips are typical of Verticillium wilt of tomato. Infected plants usually survive the season but are somewhat stunted, and both yields and fruits may be small depending on severity of attack. A light tan discoloration in the stem similar to that caused by Fusarium wilt may be found, but is usually confined to lower plant parts. The discoloration is typically lighter in color than with Fusarium wilt. Symptoms on one side of the plant only are sometimes seen. Next is the epidemiology of the disease. Moderately cool temperatures of about 20 degrees centigrade and high soil moisture favor disease occurrence. The disease incidence is more during the cold months of November and December, when temperature is about 15 to 20 degree centigrade. Now coming to the management of the disease. A long crop rotation of 4 to 6 years is necessary to reduce population of this fungi. Avoid using any solanaceous crop, that is potato, tomato, pepper, eggplant in the rotation, and if Verticillium wilt is a problem, also avoid the use of strawberries and raspberries, which are highly susceptible. Use of resistant varieties like Better Boy, First Lady, Husky Gold is recommended. Neem oil which naturally contains sulfides, has been reported to be effective in preventing the fungus from spreading. Soil fumigation with effective materials is the only chemical control available for reducing soil-borne populations of the pathogen. Next important disease is the early blight. It is caused by Alternaria solani. Symptoms of the disease: the fungus attacks the foliage, causing characteristic leaf spots and blight. Early blight is first observed on the plants as small black lesions, mostly on the older foliage. Spots enlarge, and by the time they are 1/4 inch in diameter or larger, concentric rings in a bull's eye pattern can be seen in the center of the diseased area. Coming to the management of the disease: removal and destruction of crop debris. Practicing crop rotation helps to minimize the disease incidence. Spray the crop with mancozeb or difolatan at the rate 0.2% at 7 to 10 days interval. Minimize leaf wetness by watering plants in the morning or at the base of the plant. Seeds soak in therum at the rate 0.2% at 30 degrees centigrade for 24 hours gives better protection. Next is the late blight. It is caused by Phytophthora infestans. Symptoms of the disease: the disease first appears as faded green patches on leaf, which soon turn to brownish black in color. The dead areas appear at the tip or margin of the leaves and spread downward and inward. A whitish or greyish powdery mass appear on the lower surface, corresponding to the dead areas on upper surface. Next is the management of the disease. Remove and destroy blighted tomato plants. Eliminate all tomato culp piles in the vicinity of the tomato field. Reduce leaf wetness by staking tomatoes and using drip irrigation. Growing of resistant varieties is also recommended. Use of disease-free seeds, preferably collected from disease-free area. Mancozeb at the rate 2 gram per liter used as protective application at 5 to 7 days interval. Mixture of metalaxyl and mancozeb at the rate 2 gram per liter used as protective and curative application at 5 to 7 days interval. Next is the bacterial diseases of tomato. First one is the bacterial wilt. It is caused by Burkholderia solanacearum. Symptoms of the disease: this is one of the most serious diseases of tomato crop. Relatively high soil moisture and soil temperature favor disease development. Characteristic symptoms of the bacterial wilt are the rapid and complete wilting of normal grown up plants. Lower leaves may drop before wilting. Pathogen is mostly confined to vascular region. In advanced stages, it may invade the cortex and pith and cause yellow-brown discoloration of tissues. Infected plant parts, when cut and immerse in clear water, a white streak of bacterial ooze are seen coming out from cut ends. Now coming to the pathogen. The bacterium is gram-negative, rod-shaped, often occurs in pairs, motile with 1 to 4 flagella. The optimum temperature for growth is 30 to 37 degree centigrade. Now coming to the management of the disease. Avoid damage to seedlings while transplanting. Apply bleaching powder at the rate 10 kg per hectare. Crop rotations with cowpea, maize, cabbage, okra, cowpea, maize, maize, cowpea, maize, and finger millet eggplants are effective in reducing bacterial wilt of tomato. Next important disease is the leaf curl. It is caused by tomato leaf curl virus. Symptoms of the disease. Leaf curl disease is characterized by severe stunting of the plants with downward rolling and crinkling of the leaves. The newly emerging leaves exhibit slight yellow coloration and later they also show curling symptoms. Older leaves become leathery and brittle. The nodes and internodes are significantly reduced in size. The infected plants look pale and produce more lateral branches, giving a bushy appearance. The infected plants remain stunted. Next is the pathogen. The virus particles are 80 nanometer in diameter. Next is the mode of spread and survival. It is neither seed nor sap transmissible, but seeds from fresh fruits having infection may have the virus on the seed coat. The virus is transmitted by whitefly, that is Bemisia tabaci, and grafting. Even a single viruliferous insect is able to transmit the virus. Now coming to the management of the disease. Keep yellow sticky traps at the rate 12 per hectare to monitor the whitefly. Raise barrier crops, cereals around the field. Removal of weed host. Protected nursery in net house or greenhouse. Spray imidacloprid 0.05% or dimethoate 0.05% at 15, 25, 45 days after transplanting to control vector. Next disease is the spotted wilt. It is caused by tomato spotted wilt virus. Coming to the symptoms of the disease. It causes streaking of the leaves, stems and fruits. Numerous small dark circular spots appear on younger leaves. Leaves may have a bronze appearance and later turn dark brown and wither. Fruits show numerous spots about 1/2 inch in diameter with concentric circular markings. On ripe fruits, these markings are alternate bands of red and yellow. Now coming to the pathogen. It is isometric particle of 70 to 90 nanometer in diameter. Thermal inactivation point is 40 degree centigrade. Next is mode of spread and survival. The spotted wilt virus is transmitted through thrips. Now coming to the management of the disease. The affected plants should be removed and destroyed. Alternate and collateral hosts harboring the virus have to be removed. Raise barrier crops, sorghum, maize, bajra, 5 to 6 rows around the field. Several insecticides like Confidor, that is imidacloprid, at the rate of 1 ml per liter of water should be sprayed. So this is all about the diseases. Now coming to the conclusion. Tomato is attacked by large numbers of pathogens causing different types of diseases. Among these, most important ones that cause Extensive crop losses are wilt, septoria leaf spot, late blight, early blight, and viral diseases. The most and effective and sustainable control of the diseases will be obtained when different management strategies were integrated together. If proper management and cultivation practice is followed, starting from sowing to harvesting and storing, then loss can be minimized.